Those are his people.
What's that?
I guess I would agree to.
You're born in the United States, you're a
It's a
citizen.
Supreme Court. If it was the other way, you'd be all happy.
You're citizen.
Oh, my goodness. We better start the meeting.
Isn't this like time?
We better start the meeting.
We
Born
got
in the United States.
get started.
Ever,
That's English language.
guys,
Yeah.
we're on the opposite side of this. It's
You're a
all
nice
good.
Republican. You need to get away from him.
Yeah.
Okay. Good afternoon.
Okay, sorry about that. Good afternoon. Health and Human Service will come to order. Madam Clerk, will you call the roll, please?
It's me. Commissioner Baker McCormick,
Here.
Commissioner Marecki, Commissioner Anderson,
Here.
Commissioner Colleen,
Here.
Chair Scott,
Present.
you have a quorum present.
Thank you so much, and we welcome our new commissioner. Thank you for being here. Okay. Next item, please.
B, Chairwoman's remarks.
I have none, but I'm just grateful to be here again today since I missed our last meeting. I thank the Vice Chair for handling it down. After coming to Thursday's meeting, I saw that it was a long meeting, so I thank you all for all that you did. Next item, please.
C, approval of the August 12th, 2025 meeting minutes.
Moved by Commissioner Anderson, supported by Commissioner Colleen. All in favor?
Aye.
All right, motion carried. Next item, please.
D, unfinished business. There is none listed.
Thank you. Next item.
Moving to item 1 under new business. Forwarding the medical examiner's annual report by manner of death for fiscal year 2023 to 2024.
Thank you.
Hello.
Hi, how are you today?
Good. Charlie Rose, Division Director for the Wayne County Medical Examiner's Office. And today I brought my partners, Chief Medical Examiner, Dr. Lockman Sung, and the Chief Operating Officer, Dr. Noreen Kumar.
Thank you both for being here. Thank you.
So I'll turn it over to Dr. Sung to give us the data on our annual report.
Okay. I think we got a copy of it.
You all do? Okay.
We do. I guess it was my staff that
What?
got this for me then. Okay.
Actually, I'm sorry, we're going to have Dr. Kumar start.
Oh, no, this was the debt relief, medical debt relief program.
And he'll provide some of the updates that we did for this year.
Okay.
Dear Commissioners, thank you for having a question.
The mic and give your name, please.
Yes. Good afternoon,
Okay.
respected
Okay.
Commissioners, and thank you for having me. My name is Noreen Kumar. I'm the Chief Operating Officer for Wayne County Medical Examiner Office, employed by Wayne State University School of Medicine to conduct the operations on behalf of the county. So we are here to share our second annual report, and our progress continues that we started from year 1. So some of the primary focuses in year 2 is how we can continue to strengthen the partnership with communities. So we have our first joint community alliance that comes together. This is advisory board and conducts on our operations and helps us to see what changes that needs to be done. These advisory board actually comprises of funeral homes, community members, law enforcement, and they provide us all the guidance that is needed to see what type of changes we have to do. Year 2 was really a phenomenal year for us in the sense that we were finally able to recruit our Chief Medical Examiner, Dr. Lockman Sung, with the blessings of this commission. I really want to thank the commission for helping us with that. It was a 2-year process, and we had gone through an AMN, which is an executive recruitment agency specifically for physicians, and conducted national and international search to fill this important position. The next important update I wanted to also provide is forensic pathologists. It's a shortage occupation. I mean, I kind of shared during the recruitment process, there is almost 1,100 forensic pathologists that is needed across the nation to conduct those critical operations. And we only have currently around 600 board-certified forensic pathologists. In spite of these challenges, where many offices are trying to poach each other, we were successfully able to recruit and continue to recruit forensic pathologists. That talks about the community, the improvements we made in the office, but also being the 15th largest county, Wayne County having much diverse population and ability to serve the community is very important for many of our forensic pathologists. So we were successful in hiring one of the forensic pathologists. The other big news we also wanted to share is our first fellowship program successfully started. Our cohort of the first fellows graduated, and we were able to convert one of the fellows as a faculty member, and he decided to stay with our Wayne County Medical Examiner office. So that is one of the other accomplishments we want to highlight. Being in a diverse community means we have to serve to the community members, and I think that is the core of what we do in our operations is. As we reflected upon some of our operations, what we found out is we need to change some of the practices of getting the autopsy done a little bit earlier to accommodate the cultural needs of the community members. Based on the cultural and some of the religious needs of the community members, we were able to tweak that so that any community members who have a specific beliefs or a cultural practice for an early release of the body and autopsy they cannot hold for too long, now can be accommodated with all the changes that has been done at our office. The other major impact is with our social work team. Especially, we are very few or rare, one of the offices that have social workers embedded in our office providing service to the family members who are seeking out our services. There are multiple reasons for that. The first reason is, we had a lot of homicide, and then the families in distress. They are in shock, they are processing the grief. So the social worker helped them to navigate the grief process. But it's also like some of the community members may need some additional resources. Our social workers are able to connect. We have 2 full-time social workers, and we also have social work interns who come and support the community members. In the last year alone, they made almost 1,000 calls and connected with all the community members and met one-on-one to provide the resources what they need, support as well. The other part that also social workers have done is they were able to implement a Narcan vending machine right on the thing. So any community member can walk in and get those strips with the support of Wayne County Health and Human Veteran Services Department. So these are some of the stuff we have highlighted, but we made a lot of progress, and I don't want to take up a lot of time of your valuable time, but all the details on the report, I'm going to pass on to Dr. Sung to talk about the specifics of numbers.
Thank you.
Thank you.
Thank you so much. Are there any questions of the doctor? Go ahead, Commissioner Anderson.
Might as well do it now, I guess. I
Yes.
just wanted to ask, first, I want to thank Charlie for getting back to me on an issue. But what came out of that, I think, too, is that our toxicology reports are done out of state to Texas. And is there not some way to do that in state? Is it a matter of cost? Is it availability, or what is the reason that we're going to Texas for those?
Yeah, absolutely. Thank you, Commissioner Anderson.
Which adds time. I'm reason I'm asking.
Yeah, absolutely, Commissioner Anderson. I'll share some of the broader context, and I know the specifics will also be shared by Dr. Sung, who interacts with the toxicology team. One of the things that when we are looking for any toxicology team is, are they able to accommodate the scale and scope of what our office does, right? The volume and the turnaround time. There are very few approved, like this is a name accredited toxicology services that can fulfill the needs of what our office volume is. And one of the services is NMS, which we have been using in the past, and we continue to use it. But it doesn't mean that we're going to continue to use them for a long term. Being part of the partnership with Wayne State University is that we have a School of Pharmacy and Allied Sciences. So we are exploring options of how we could potentially insource down the road. We currently do not have the capacity right now, so that's why we continue to use the NMS services. They have been a star, especially in the field of toxicology pertaining to medical examiner office. And I think the reliability of the data they provide is very crucial for us to rely on the cause and manner of the death. But I'll also let Dr. Sung add a little bit more.
Thank you.
Lachman Sung, the Chief Medical Examiner at the Wayne County Medical Examiner's Office. And Dr. Naren Kumar is correct. Whenever we are exploring laboratories to perform our analysis, we have to make sure that they are able to handle the volume in which we would provide them samples with. In the exploration of laboratories, we did evaluate a different laboratory. Currently, our laboratory is NMS Labs in Pennsylvania. Our initial laboratory actually was in Texas. It was AIT. And unfortunately, that laboratory was not able to provide us with results in a timely fashion and to the integrity that we needed. Because of that examination, we needed to switch to a different laboratory, the one that we currently use, NMS Labs in Pennsylvania. And regarding your question specifically, on a monthly basis, we have in-person meetings with representatives from the laboratory, and they provide us with data as far as their turnaround times and also any specific tests that they're bringing on board. In regards to turnaround times, the NMS Labs is able to, for the most part, provide 100% completion of the cases within 30 days. Now this, it's not always going to be 100% because invariably there will be those rare cases that we need additional ancillary studies. So that expands it slightly. But in general, nearly 100% of their cases are completed within that 30-day timeframe. In our exploration for other options, such as bringing it back in state, we would have to mimic similar turnaround times because it is not our goal to jump to a system that would hamper our ability to complete our autopsy reports. Also, whatever laboratory we explore would have to also be able to produce results and have a toxicologist who is able to and willing to testify in court to those results. So those are all the various things that we are looking for, but we absolutely are exploring other options.
Is that a normal turnaround time, 30 days to 60 days? And I'm wondering if we shouldn't, please explain to me, I'm not that knowledgeable certainly on autopsies and toxicology reports, but is there some reason that 30 days? I mean, once a lab receives that sample, I assume it's a internal organ sample or something, and what causes it to be that long of a period of time? I just don't know.
Right. As a point of reference, 30 days is in the realm of toxicology a short amount of time. Prior, when we actually had an in-house laboratory, it would take several months before we received the toxicology results. So NMS Lab was able to provide us these results, once again, nearly 100% within that 30-day time frame, which we appreciate. And the reason why that's appreciated because not only does it provide us with rigorous quantitation of the data, but also the interpretation from the toxicologist. So when we are examining the toxicology data, there might be polypharmacy within a sample, meaning multiple drugs. So by having the interpretation by the toxicologist, we are more easily able to determine if a drug resulted in a person's passing. So that 30-day time frame is a very good one. If we roll back the clock a little bit, back in July of 25, which was just last month, 73% of the cases were finished by 14 days. So it was just that last little hump that took the extra 30. So the majority of the cases are completed well before 30 days, but went nearly 100% by 30.
Okay, all right. Thank you. Thank you.
Thank you. Was there any, Commissioner Marecki?
Thank you, and sorry I'm a little late here. Yeah, I was amazed at 30 days. I think that's pretty amazing. I mean, you've heard of like movie stars, it takes 6 months to get that. But are there certain drugs that would have to wait for longer than 30 days to know if they're like in the system or?
Right. Most of the tests that NMS Labs provides, there is no delay because they have volume of scale. They're able to very easily batch a set of samples and run it on their machines. In a smaller laboratory, because of reagent cost, they may have to wait for enough samples to come before they run a test. The benefit of having a national laboratory is they get enough samples that they run these tests routinely.
Got it. Okay, thank you.
Thank you. Anyone else? Okay. All right. I know you just answered the question, but was there some other things that you wanted to talk about?
If you wanted to speak specifically about the annual report, I'm more than happy to do so. But before I get into the actual numbers, one thing that is important to understand is the annual report is a snapshot in time, while data that comes to our office is essentially a living, breathing creature, because as time progresses, we will finalize cases, and these numbers, once again, is just a snapshot in time of when the data was acquired. Regardless of when a data pull is performed, the individual numbers may vary, but the trends will survive. So the trends in what I'm going to be talking about will be applicable regardless if you look at the data now, tomorrow, or the next month. So when we look at the different manners of death, they are going to be natural, homicide, suicide, accident, and indeterminate. These are the 5 manners here in Michigan. And a trend that I am happy to report is that the natural manner of death has, once again, become the most common. In the past few years, particularly during the COVID timeframe, we had more accident manners of death than natural. And unfortunately, and it still is true, but unfortunately, many of those accident manners were involving drug-related deaths. Drug-related deaths are still very high, but once again, natural has overtaken that. And that is something that can be applauded to by our hospital systems and our healthcare systems. In addition, the rates of homicide has also decreased. This year, we have enjoyed a 17% decrease in the number of homicide cases. Once again, I applaud the efforts of law enforcement for that. And that is a trend that is continuing through the years. And I hope that this year will also continue that trend. Last year in the fiscal year 23-24, and this was throughout the country, the number of deaths was lower than the previous year. Unfortunately, this year we have picked back up and we are following previous trends. But the numbers here in the fiscal year 23-24, once again, the trends are similar, but the physical numbers are a little bit lower than previous annual reports. Regarding I spoke about natural deaths, I spoke about the homicides. In general, accidents are still fairly high, and drug-related cases compose the largest component of that. And of the drugs, unfortunately, still fentanyl is a major reason why people are passing. In this fiscal year, there was a combination of fentanyl with cocaine, which was not seen in the previous fiscal years. In the previous fiscal years, cocaine and heroin were drastically decreasing as fentanyl was increasing. Now cocaine is coming back. We have not seen a rise in heroin, but once again, cocaine is starting to creep back into the population. Regarding suicide deaths, the suicide deaths have not significantly increased or decreased as compared to the previous fiscal year. Also, the makeup of sex, males and females, has not drastically changed. there was a small percent increase in the number of suicide deaths, but that is within the margin of error of gathering the statistical data. So I don't want to draw any conclusions based on a single data point. The indeterminate deaths are those deaths in which we are unable to determine a precise cause of death or precise manner of death. It can be due to lack of information from investigation, or it could be from the status of the body itself. In general, our office has had a very steady, very low percent of incomplete or indeterminate deaths, and we plan to maintain that through the upcoming years. If you have, once again, specific questions about the tables that you see, I'm happy to discuss those. But once again, those are the numbers in general.
Okay. Commissioner McCormick?
Thank you, Madam Chair, and thank you for your presentation and for being here today. So my interest lies in the drug cases. It was 663, and they're considered accidents, I assume, because you, I guess, can tell that it wasn't on purpose. It was from, I assume, fentanyl. That's what you were just alluding to. Are all of those the case, or you just kind of lump them together in the accidental drugs? Oh,
You're correct in the classification of most drug deaths fall under accident unless we have a clear-cut indication that an individual took a drug to end their own life. We place those
in suicide.
into accident manner.
Okay.
And unfortunately, a majority of these drug-related deaths are fentanyl-related. Not all of them, but the majority are. There are many cases in which we see multiple drugs present. And when there are multiple drugs, we will list the ones that are most relevant in the cause of death. But the majority of these happen to be fentanyl.
Okay. And I was interested in knowing if this were what the breakup was of, Black males, females, just by demographics.
Right, that-
And
That is not in this annual report. However, we can make modifications for future ones to include the racial distribution.
because my understanding, and we don't see the numbers here, so we don't really know if it's what you consider an epidemic or an emergency, and what that will look like. 663 deaths is a lot to me, especially if they come from one area. So that's why I'm really interested in knowing what that looks like. And at what point would we issue some type of county emergency or epidemic? Have we done that? Do we ever see any cases?
Commissioner McCormick, I mean,
Yeah.
you're really touching on one of the important points that is also in the report as well.
Okay.
What we are trying to do is early response and identifying whether it's happening in a certain PIN code is going to be very important for public health emergencies and response teams. The state of Michigan has an initiative called STORM, and Western Michigan University School of Medicine is the grantee for the STORM project. So we participate and collaborate with the STORM project. So what it does is it kind of helps us in identifying early opioid-related substances or any kind of fentanyl or novel substances that's emerging in any community members. So we can work with our public health officials and colleagues in Wayne County to alert them that we see a trend that's emerging right now. So the test has to be validated by NMS because sometimes, I mean, when an early screening is done, it may lead to different things. So we also do validate at secondary as well to make sure it's all correct. But that is an early system that'll be able to help us to know. The second thing we as an office, we are currently working on, and maybe when we come back to report our third year report, we'll have this, is we are working with CDC Foundation to create a heat map, which basically kind of like pulls us really saying in a real time where those drug-related deaths can happen, and then is it concentrated around a certain zip codes that the public health officials need to change their strategy to address the deaths can be done.
Okay, great, great. How about the suicides? It looks like they're, I don't know if this is a uptick. I don't know the trend, but 166 males. Do we know the demographic of them, and do we have any demographics on that? I do see we have the homicide kind of broke out, but I would just be interested in knowing when you have a higher number of folks, that would be just information that I think would be helpful for us to know what that looks like.
Yes, absolutely. In preparation for our next annual report, that is data that we can provide. And,
Okay.
something that we are also engaging in is creating real-time dashboards in which we can interrogate the data in that fashion. So
Okay.
we can sit here, and if you have that question, provide that once again in real time to you.
Okay. And then my last question is, what is pending? Are you in the process of investigating, or what does pending mean when it comes to the case?
Your interpretation is absolutely correct.
Okay.
Those are cases in which we are still exploring the cause of death. It may be pending the toxicology analysis. It might be pending review of medical records or police reports. So there's one component or multiple components of that case that we require in order for us to render the diagnosis.
Thank you. Thank you, Madam
Okay,
Chair.
thank you. Commissioner Khalil.
Thank you, Madam Chair,
Mhm.
and good afternoon, everybody. I really appreciate your report and the depth of it and what you cover. It was only a few years ago that the county ran the MEO's office. Lots of difficulties. The possibility of a partnership with Wayne State came up. We had a few discussions in this committee and as a commission regarding that relationship. And I felt very comfortable with it, which I was a big fan of moving it forward. And I think this is some evidence. And just going back in time a little to University of Michigan, and it took forever to come back. I mean, forever. That was one of the things, and we had a similar discussion to this. We were also discussing at that time a nationwide shortage of pathologists, and one of the things Wayne State could bring to the table is they train them over there, and I'm glad to see that that has worked out, that we've been able to, because I'm sure that shortage is still there nationwide. I want to and the previous discussion, because how do we use our data in a way that we hadn't used it before, like trends in society and getting on top of that and type of death and all that kind of stuff. And so I'm glad to see that moving forward. But I want to ask about the governance structure. As I read through this, I see two things. I see a joint advisory committee, and I also see an executive committee, which I assume is a subset of the joint advisory committee. I think it lays out in here who sits on the executive committee. Who comprises the joint advisory committee, and do you have categories that you recruit from? How is that constituted?
So the Joint Advisory Committee is comprised of, it's 2 funeral directors. It is a fire chief as well as a police officer from the homicide department. Dr. Sung, of course, is on the Joint Advisory Committee, as well as Thane Peterson, who is also from Wayne State University, and myself.
So it's a relatively small committee.
Yes,
Okay. How often do you guys get together?
we meet quarterly.
Quarterly?
Mhm.
Okay. And the job of the Joint Advisory Committee is to do what?
So they pretty much help us, because of course they're the eyes and ears of the community, and they bring to us any concerns that they heard from our office, and they just help us to make our office better.
Do we rotate like a police chief through there?
No, we haven't.
I'm gonna take a shot in the dark and say it's the DPD's chief.
Yep, it's Officer McCord. She's over homicide.
I
Detroit.
thought you
Detroit,
had
I'm sorry.
police chief and,
No, I'm sorry, from
homicide.
fire department.
huh?
We have someone from the fire department, I'm sorry.
Yeah, Detroit.
And no, I'm sorry, he's from Dearborn.
Okay.
Mhm.
Yeah, because I was gonna ask, big county,
Yeah. Mm-hmm.
from where I live on the east side, it's an easy, I don't even know, Brownstown Township barely exists from where I
Mm.
sit, and it's a good hour drive away. Big county, diverse county. Have we rotated people through that advisory board to get kind of?
No, we haven't yet, but
Okay.
we can look into that.
Yeah.
Yeah.
Um,
Thank you for that.
where we at with accreditation? You know, that was always a big thing too, that we could never get accredited, and, you know, we had some steps to go through, like maybe another pathologist or two. Where are we at with accreditation right now?
As currently, our office has provisional accreditation with named the National Association of Medical Examiners. This is our last accreditation year, and in December, we will be applying for reaccreditation. And at that time, NAME will send an inspector to our office to evaluate our office in an on-site fashion versus a virtual/paper version. So NAME has two classifications for their accreditation. There are offices that are fully accredited and then those that are provisionally accredited. For full accreditation, they have a breakdown of different types of violations that an office may have, a phase 1 and a phase 2. Easy way to think about it are phase 1 violations are those violations that, although need modification and correction, don't directly impact the work product that an office produces. Phase 2 are those ones where there may be major impacts to the work product, meaning the autopsy report. So right now, as I said, we have provisional accreditation, and they're divided into two arenas. One is the building itself. There needs to be major modifications and repairs and renovations to the building to bring it to a place in which we can perform our autopsies in a fashion that anybody would love to work at. Everybody within the building loves to work there, but we know that there are things that need to be improved. And we are
And
actively.
if I can comment on that a bit, the county screwed up when they built that MEO's office. They built it to Florida specifications. Somehow that got in there. So the whole heating and cooling and, oh man, we spent a ton of money in there, and there still is some work needed on that building.
Yes.
I take
absolutely.
it. Okay.
The second arena is with staffing levels. And here is where Wayne State University is actively engaged in recruiting physicians to our office. And although I have not run the final numbers, I will wait till closer to the time we apply. But right now, we're standing very close to eliminating the phase 2 violations for the physician numbers. I make no guarantees because, once again, I haven't run those numbers, but because of our recruiting efforts, we were able to retain our fellow as a staff pathologist. And we also have additional support from locum tenens who come to our office to just ease the burden a little. Our goal is to have a reduction in the locum tenens and have actual staff pathologists, but at the current time within the nation, there is the drastic shortage of forensic pathologists.
So do we apply for full accreditation? Is that what we do?
Yes, we apply for inspection, and it will be
Okay.
the inspector who determines whether we qualify it for full accreditation or provisional.
So we must like apply annually? And then they come back and tell us where we fall?
The initial inspection, if you are granted full accreditation, has a 5-year cycle. So you would have a 5-year period in which you need to report back on an annual basis. For provisional accreditation, which we currently have, it is a 4-year cycle. So they grant you provisional accreditation and you need to annually provide them with data that you still meet that requirement.
Okay, is NAME the only organization out there? Are they the only game in town for accreditation?
No, there are
That's what I
other,
thought, yeah, because like schools can go to different accrediting. You know, and they go, oh, we're accredited this year, and the school next door might be accredited, but it's 2 different organizations. So, why are we hooked up with NAME if there's other ones?
NAME is one of the nationally recognized organizations or accrediting agencies. There are others, for example, ISO, the International Standards Organization, that has additional requirements of an office. And in my opinion, their level of accreditation would be higher than that of NAME. They also have stringent requirements for laboratory services, of which we don't currently provide. But if we engage in a toxicology fashion, then we would have to bring that lab up to those standards. Each individual laboratory has within its own profession standards, but if we were to try to go for ISO accreditation, I think it would be a larger hurdle for us.
Well, just, you know, one thing I've learned through being on this committee forever and being the nephew of an undertaker, Irish Catholic, I know a whole lot of undertakers out there. The essential role in society that a medical examiner plays for the citizen, I mean, that's a real basic, to me, a basic function of local government is to be able to provide that for its citizens to know what. So I am delighted that we're on the upswing here. I'm very happy with the relationship, and I look forward to the continuing reporting and the continuing improvement. So thank you. Thank you, Madam Chair.
All right, thank you, Tim. Excuse me, Commissioner Mareki.
Thank you, Madam Chair. So who cares about your accreditation?
In general, by being an accredited office, it indicates to anybody who receives an autopsy report, they have that guarantee that we are performing our duties to a certain standard. It's not just some people got together to do some autopsy work. There are standards in which we must perform our autopsies, our toxicology, our histology, and also the administrative arenas, because all of those are involved in the accreditation process.
So the families would care
Mhm.
if you were accredited and the undertakers or whatever.
Yeah, Commissioner Merrick, I mean, just to add on more, I mean, it's multi-level of who would care. Dr. Sang was explaining the process of why the families, undertakers, the other public agencies who rely on the quality and the validation of the report we provide for multitudes of things, even the judicial systems. But also, I mean, as far as attracting forensic pathologists and to have that educational piece, that validation needs to be there because the fellows specifically look for accredited officers to train themselves to be a valid forensic pathologist. So that's an additional layer I want to add on.
Okay, no, that's a good point. So how much does it cost you to do this on the 4-year and the 5-year cycle to get it accredited?
I believe the initial application is roughly $5,000 and each reapplication is another $1,000, but I'll
Okay.
have to look specifically.
So it's not real expensive, like some of these accreditations are crazy. Okay.
No.
All right, thank you. Thank you, Madam Chair.
Thank you. Excuse me, Commissioner Anderson.
Thank you, Madam Chair. I just wondered, I've been seeing reports of the number of shooting deaths in the city. And I'm sure it spreads beyond certainly the city of Detroit, but the accidental shootings, some intentional. And one report I read that as far as young people and children, up 39%. And are you seeing that coming into the morgue too? I mean, I'm sure you have most of those.
You're correct. It does not fall under this fiscal year because it would be the 25-26 fiscal year, but you are absolutely correct. We are seeing a market increase in the juvenile population that have died of firearm injuries. It's unfortunately not uncommon now that every week we may see 2 or 3 teenagers who have been shot.
Sad, very sad. Thank you.
Yes. Wow. Thank you so much for this report. But anyone else? You don't have to be on the committee. You can, okay. Oh, okay, all right. You're good, okay. Okay, all right. Well, thank you so much. This is a fantastic report. We do appreciate it. Yes.
Thank you,
Thank
Chair. We appreciate the opportunity.
Okay. Can I have a motion?
To receive and file?
Oh, yeah,
Yes.
this is receive and file. Right. Okay, it's receive and file, and that's all in favor is receive and file? Okay, all right, thank you. Next item, please.
Moving to item 2 on the agenda, requesting commission approval of Amendment 3 to a 1-year grant agreement with the Michigan Department of Health and Human Services to accept additional funding for the fiscal year 2025-26 Local Health Department Comprehensive Agreement used to support various public health programs.
All right, thank you.
Good afternoon.
Good afternoon.
Commissioners. Dr. Brianna Osorio, Director of Public Health Division. And so this is our accepting of funds, a certifier funds for our CPBC agreement that we have that supports several of our public health programs. We get approximately 3 to 4 amendments throughout the year. So this is a 3rd amendment that we were expecting for. This supports our emergency preparedness initiative, and our CRI initiative. So those are both our emergency preparedness and management programs that are supported by this amendment as well. And we also have our public health infrastructure grant as well that we have until about November 2027. So these are just additional rollover funds that we weren't able to use in the previous year that we'll still have access to throughout the year to support any type of infrastructural improvements that we're trying to make at our health administration building, which of course we need some. It's supporting our software that we're also trying to update for some of our programs like our environmental health program and our badging system, things like that. So these are pretty much those pretty standard.
All right, thank you so much.
No problem.
Any questions? All right. Well, since we don't have any, thank you so much, Doctor, for the
Thank
report
you.
today. Yes.
Thank you.
Okay, okay. Motion. Commissioner Maraki. Commissioner Anderson, support. All in favor? And I vote yes. All right, thank you. The other two had to leave, I guess. All right, next item, please.
F, such other matters as may be properly submitted before the committee.
Okay. Okay,
And then you gotta click. Oh, she got it. I think she.
okay. Sometimes I forget that we're using that. Okay. Okay. Motion carried. Next item, please.
F, such other matters as may be properly submitted before the committee.
I don't know of any. Next item.
G, public comments.
Is there anyone on the line?
There's no one on Zoom with a hand raised, and no emails were received.
All right. Thank you. Is there anyone in the audience? Get out.
The table.
You want to come to the table, please? Mm-hmm.
How much time? How much time? 1 minute, 2 minutes?
Oh, what do we give?
1 or 2?
2 minutes.
My name's Carla West.
Sorry. I'm sorry, that's Carla.
There. Thank you. Sorry about that. My name is Carla Ruest and I work with Vista Maria. And as you know, Vista Maria works with foster care kids, adoptive families, and has a residential program for foster youth who have experienced severe abuse, neglect, and exploitation. I know this committee has had some interest in Vista Maria, and I come to the committee today to invite you all to come out to Vista Maria, meet our new CEO, learn about our innovative programs, and see some of the renovations that have happened at Vista Maria. So I have an invitation here, and that's I'd like to pass out, and we'd love to have you come out and learn more about Vista Maria. Okay, thank you.
Who's the new director?
Kathy Regan.
Kathy Reed.
Yes.
Okay.
All right, may I pass this out? Thank you.
Okay. Commissioner Anderson would.
I was just going to say, Madam Chair, since you were in Lansing too, you
Right.
probably remember Carla.
Uh-huh. I remembered the face, but I was trying to. Yes.
Thank you.
And I've gone to Vista Maria a lot.
Thank you.
But not lately, because I hadn't been invited, but you're inviting us.
We would love to have you come out. I think you'd be really impressed with some of the renovation and some of the programs that we are running right now.
Okay,
Okay, thank
all
you.
right. Okay, thank you very much.
Thank you.
So September the 19th. All right. Thank you. Next item.
Adjournment.
If there's no one else, we're adjourned by Commissioner Anderson and supported by Commissioner Marecki. All in favor? Yes. Thank you. Okay. Thank you so much, and thank you everyone for coming.